Welcome back. In Module 1, you learned that type 2 diabetes is caused either when the cells in your body are unable to respond to the hormone insulin, or when the pancreas is unable to produce enough insulin for your body needs. In this module, we will explore signs and symptoms of diabetes that may seem familiar to you. We will also focus on the effects of high blood sugar on the different organs of the body. As you may remember, every cell needs glucose for energy, and the hormone insulin's main job is to move glucose into every cell of the body. When glucose, or sugar, cannot enter into the cells, it starts to build up in your bloodstream. When that happens, cells lack the energy they need to work properly and begin to die. This may happen in several tissues of the body. Signs and symptoms of type 2 diabetes. Some of the symptoms of type 2 diabetes you may have experienced are frequent urination, increased thirst, dry mouth and dry itchy skin, blurry or changing vision, tiredness, fatigue, sleepiness, constant hunger even after eating, easier to gain weight and harder to lose weight, but may also have unintentional weight loss, slow healing wounds or sores, frequent urinary tract and/or yeast infections. Sound familiar? Now, let's explore what was happening in your body to feel these. When blood sugar rises, the body tries to get rid of the excess sugar, and it forces the kidneys to produce up to twice as much urine as usual. This, in turn, causes dehydration. Of course, dehydration makes you very thirsty, and you want to drink more. But if what you drink contains sugar, guess what? The process starts again, and your body produces even more urine. It's a vicious cycle. Dehydration can also cause your vision to become blurry. When insulin loses its ability to move sugar into the cells begin to starve. Your body reacts to this starvation, making you feel hungry. No matter what you eat, it's not enough. As a result, your body does what it can to help by breaking down the stored fat and using it for energy. This is why you may experience some weight loss. The mechanism of breaking down fat for energy is meant to be only temporary, used by the body in emergency situations. Long-term burning of fat can be very dangerous to your health. Now, because you're not receiving the energy that you need, you feel tired all the time. High blood sugar is also the perfect medium for bacteria and infection to thrive. As a result, sores may not heal as fast as expected. Yeast infections in the mouth, also known as thrush, are common. Urinary tract infections or vaginal yeast infections are frequent and may last longer. As you can see, high blood sugar can affect your body at all levels. Now that you have been diagnosed and probably have started taking medications, it's time to become aware of the habits and behaviors that can help keep your blood sugar within the recommended levels, so that you can reduce the symptoms and start to feel better. You should do as much as you can to keep your blood sugar within the recommended target range to avoid severe long-term complications. That's right, the target range is 80 to 130 milligram per deciliter. Secondary complications of type 2 diabetes. In the long run, when blood sugar is not controlled, even more serious problems can occur. These are known as secondary complications. When there is extra sugar circulating, your body will try its best to get rid of it. But soon, that extra sugar will begin to coat cells in almost every organ of the body. Over time, extra sugar will harm your organs, hindering their capacity to function normally. The secondary complications affect all body systems. In your heart, cardiovascular disease may result in high blood pressure, high cholesterol, and triglycerides that can lead to heart attacks or even strokes. When sugar coats your nerve tissues, neurologic damage to tissues occurs. For example, your toes, feet, or legs may start to lose feeling. If you have an injury, you may not feel the pain and think the injury isn't serious. Excess sugar encourages bacteria to grow, slowing down the healing processes. If blood sugar remains uncontrolled, this is how persons with diabetes lose their toes or even their legs. Loss of feeling, numbness, or tingling in the tips of your fingers may also cause injury and impact your fine motor skills. Picking up small objects such as pennies or threading a sewing needle may become challenging. Your digestive system slows down. This causes constipation or unexpected diarrhea and severe vomiting that isn't related to any infection. In your vascular system, the nerves that control blood vessels begin to act erratic. For example, causing a drop in your blood pressure when going from sitting to standing, or blood that doesn't reach the areas in need of healing. In your eyes, high blood sugar weakens the tiny vessels of the eye and may cause leakage of blood into the retina, resulting in eye or retinal disease that can lead to blindness. In your kidneys, type 2 diabetes is one of the main causes of kidney disease, present in 1 out of 4 adults with diabetes. This happens because high blood sugar alters the lining of the vessels in the kidneys, affecting their ability to filter urine. Over time, this leads to kidney failure. Treating kidney disease may ultimately require dialysis or transplantation. All of these symptoms can be troubling and overwhelming. Sometimes we just prefer not to think about any of this. That is a common feeling. Maintaining blood sugar within the range is not always easy, but your efforts, along with the support of your healthcare team, will help you prevent serious secondary complications. A good treatment plan, including medication, can help. Better yet, the most effective way to prevent or reduce these secondary complications is to make healthy lifestyle changes now so that you can keep your blood sugar within the recommended targeted range. Make every effort to work with your healthcare team to develop a routine that works for you, including healthy eating habits, a regular exercise routine, and the right medication plan. Let's recap what we have covered in this module. We learned that before you were diagnosed with diabetes, you may have experienced some signs and symptoms like frequent urination, extreme thirst, excess hunger, and even persistent infections. We also learned that when living with type 2 diabetes, uncontrolled high blood sugar causes all sorts of problems over time and results in harmful effects to your organs, including heart, nerves, stomach, kidneys, and even eyes. The good news is that many of these symptoms and complications can be controlled or avoided altogether when you maintain blood sugar within the recommended target range, commit to a balanced diet, and exercise regularly. The next module is an overview of the management pillars used by you and your healthcare team to guide your diabetes management plan. See you there.